All right. Well, good morning, everyone. We really appreciate you all taking the time this morning to hop on this webinar and to learn more about the Christian Health Associations. I know as we were preparing for this webinar, I was sharing with everybody that personally, this is a topic that's of big interest to me. We really believe in the power of connectivity and partnership and having that one leader organization representing so many and the power that that can bring. So I know this is a topic near and dear to my heart. Today I'm thrilled to have the panelists we have here with us today. We're going to hear from Peter Yeboah, the Executive Director of the Christian Health Association of Ghana and the Chair of the African Christian Health Associations Platform. And we also have with us Lebo Mothae, Executive Director of the Christian Health Association of Lesotho and the Vice Chair of ACHAP. So for all of you on the call, I think most of you or all of you are pretty familiar with CCIH, but I think it's important to just remind us all about CCIH and the great work and advocacy they do for us each and every day. I know Mona and Kathy are on the call and they wake up every day just thinking about Christian healthcare and how to connect us and how to make all the work we're doing more valuable. So CCIH has approximately 150 Christian organizations a part of it, 20 key partners, and hundreds of individual members as well. And it is their true mission and passion to promote health and wholeness from the Christian perspective and provide opportunities for capacity building, network, and sharing of best practices and advocacy for all of us working in the field. I'm kind of a little bit new to CCH. It's been a couple of years now, and I've really loved working with the group. And I have the privilege of co-chairing the Health System Strengthening Working Group, along with Janelle Williams. And we've really loved getting involved and starting thinking of practical ways that we can help support the CCIH team. I am the executive director of the Dalton Foundation, located in Cleveland, Ohio. Before that, I lived and worked in Haiti and got a lot of my experience there. But we are also looking and working in a lot of different areas in Africa as well, doing some health system strengthening projects. As we get started, I just wanted to explain a little bit about the flow of this webinar and what we're going to do, because we want to definitely allow plenty of time to hear from everybody, because we know you all ask the best questions. So we really want to leave time for that. First, Peter is going to start off by sharing a presentation that he and Lebo worked on that's going to explain the overview of the Christian associations, their purpose and function, their benefits, and how we can all become involved and more supportive of the work that's going on. As they are speaking, we hope and pray that you will have some questions that arise. So we want to encourage you to type the questions in the Q&A box. Don't put them in the chat box because we won't receive them, but please put them in the Q&A box, and Mona is going to moderate that for us, and we can hopefully get through all the questions today. And we will hold all the questions until after the presentation, but feel free to begin typing them while they're talking. This webinar is being recorded, and after it's over, you will receive a copy of it that you can share, and you can also find it also on the CCIH website under the Resources tab and the Faith-Based Global Health section. So, without further ado, I want to turn it over to Peter. I'll introduce Peter. Again, as I said, he is, I think a lot of y'all know Peter. He's been around for a while and doing some great work, and the Executive Director of the Christian Health Association of Ghana, and also serving as the Chairman of ACHAP. So Peter, we are thrilled to have you here. I'm gonna also we'll also hear from Lebo. I want to introduce her as well, because at the end of the presentation, we will do some Q&A, like panelist style Q&A, and we'll hear from Lebo. As I said earlier, she's the Executive Director of the Christian Health Association of Lesotho, and also serving at ACHAP as well. So I think they are both really well positioned and experts on the CHA organizations, and will give us a lot of great information today. So Peter, I will turn it over to you.
Hello, am I online, please? Am I online?
Yes, Peter, I can hear you.
Yes, very well. Very good. So is the project online?
Yes.
Okay, very well. Right. So good afternoon, friends. And I'm very happy to be here together with my partner. So my presentation will be looking at, three key questions. Asking what are the various forms a Christian health association can take, and what do they do for their members? And then ask the question, why and how should your organization partner with a Christian health association? And then go on to answer the question, if there is not a Christian health association in your country, how do you start one? In other words, I'll be answering the question, what is a CHA? What is the nature of a CHA? And what are the specific roles and functions of a Christian health association? And in any case, where you would wish to start a Christian health association, what are some of the requirements you might wish to consider? So to the first question of what a CHA is. A Christian health association, otherwise known as a CHA, is simply a national umbrella body or a network of Christian faith-inspired health providers or institutions. Normally, it's a coming together of a network, a body of Christian faith-inspired institutions. And they are also known as mission-based providers or church health services with a much broader range of actors who are otherwise known as health-engaged faith-inspired institutions. In countries, CHAs could take two types. One I call the composite type, and the other the split type of a CHA. Now, if you take the composite type of a CHA, we have examples in countries like Ghana, Lesotho, Zambia, and then Zimbabwe. So in Ghana, we have Christian Health Association of Ghana. In Lesotho, we have Christian Health Association of Lesotho, otherwise known as CHAL. In Zambia, we have CHAS, and then in Zimbabwe, we have the Zimbabwe Association of Church-Related Hospitals. And then when we come to the split type, in Uganda, you have two types of CHAs. One, you have the Ugandan Protestant Medical Bureau, and then in the same country, we also have the Ugandan Catholic Medical Bureau. These are all split CHAs in their own right. In Kenya, we also have the Christian Health Association of Kenya, and that is a composition of all the Protestant groups. And then we also have the Catholic Health Commission of Kenya, CHCK. So these are the two main types that a CHA could take, either the composite type or the split type I have already identified. So what's the nature of CHAs and what are the distinctive or distinguishing features per CHA? Normally, a CHA is a coming together of diverse denominational groups. If you take the Protestant, they could have the Presbyterians, Methodists, Anglicans coming together. So they are all diverse Christian denominational groups. And these denominational groups come together with a common Christian faith and values. Normally, their mission or their motive is to evangelize through faith and healing and to promote Jesus Christ's healing ministry. And oftentimes, because of their very mission and faith and values, they are classified as private, not-for-profit providers because mainly they are into the business of healing, not for profit, but to promote the healing ministry of our Lord Jesus Christ. So their main mission mostly is to provide quality health services to all, especially the poor, the needy, the marginalized, and the neglected segments in unreached areas, in hardship areas. That is what they are known for. And often they are also driven by certain core values and principles, values of justice, equity, and unity in diversity. So these distinctive features define CHAs in many ways. So what are the specific functions of a CHA? In other words, what could also be the benefits of being part of a CHA? CHAs typically have certain specific roles and functions, which comprise the following. One is advocacy. CHAs in countries like Chad, or in Ghana, Lesotho, and the rest are usually found, in close partnership with government development partners. So they are always at the policy table, and they're always projecting the Christian values in policy formulation. So when it comes to planning and policy making at the national level or at international level, CHAs are usually involved in advocacy to ensure that the Christian values of equity, justice, and and solidarity are projected in the way policies are made. CHAs are also involved in communication and health information. They scan and scope the environment to see what is it that could be communicated to member institutions to ensure that they are better informed in the way they conduct their core mission of providing services to the poor and needy. They are always also offering technical assistance and training, aware that normally the disparate and the disconnected member institutions require certain specific technical assistance in areas of health information, service delivery, health financing, and all the other areas. So CHAs typically will be providing such technical support and training for its members. And then, of course, capacity building or institutional strengthening. Most CHAs, with all the best of intentions, usually would require support from a higher or apex body to provide technical, support in terms of strategic planning, organizational development, human resource management. And these functions are so relevant in most countries because member institutions will always require proper human resource planning, the way to plan for their future, to promote the growth and development of their constituent institutions. One key function CHAs do is resource mobilization and administration. Now, CHAs often serve as intermediary organizations to scan and scope the development environment, partnership environment, to source funding, and then to equitably distribute these funding to member institutions to deliver services. So you find in Zambia, you find Charles is a major recipient of global funds. They receive these resources and ensure the equitable dissemination of their member institutions. In Ghana, in Lesotho, PEPFAR, programs and projects. In Kenya, you find CHAs very active in mobilizing resources around the global world and to ensure that member institutions also have their fair share to provide services. Now, monitoring and evaluation and possibly research are also very important aspects of CHA's functions. If you look at the way Christian health providers are organized, they are normally located in remote, rural, and neglected areas. And therefore, the need to coordinate, to harmonize, and to actively support these member institutions are very necessary. So CHAs are normally required, or they are involved in monitoring and evaluation to ensure that planned activities or planned programs are usually in line, and then conducting research using data and transforming them to information and learning new innovative ways of doing things are very necessary. In some CHAs, the need for supply chain, available medicines, equipment, and resources are very necessary. So some CHAs are involved in joint procurement of medicines, and equipment and all the other vital inputs required to provide services all over. In Kenya, in Uganda, in Lesotho, in Ghana, most CHAs are involved in joint procurement to ensure that medicines supply are made affordable, accessible, and of high quality level. Now, one key factor, very important, is this. Normally, in countries where CHAs are situated, one key actor is the government or the public institutions or other actors and players. So CHAs being the representative voice of the entire group, are usually involved in negotiations and intricate collaboration between the government and other partners to ensure that relationship building are highly, highly upheld there. In Ghana, for instance, these negotiations have led to memorandum of understanding between CHAG and the government. In Lesotho, you have such an arrangement that are there. In Zambia, in Kenya. So these negotiations are very intricate, very complex, and you find almost always CHAs are highly involved in ensuring that the negotiations are always made to reflect the values and ideals of Christian health associations. Now, there are other two key functions and roles that CHAs are always expected to, to provide. One more is visibility and representation. Now, normally, CHAs, as they are very shy to project their true identity, so they avoid publicity. And yet, in the policy environment, in the national environment, there's always the need to demonstrate attribution or contribution into national health service delivery. So CHAs always ensure the visibility and representation of their member institutions at all levels. Often, we are disconnected, we are really, separate, and therefore there's always the need to have that representative voice or the need for collective existence and voice at all national level. So CHAs in the country will always represent the interests and values of members. So visibility and representation at all levels is very important. And then, of course, serving as liaison between government ministries and other partners to address the functions that I've already demonstrated above. So liaison role is so important because the government in many countries will not be able to deal with Presbyterians, Methodists, Catholics on different levels. So in order to project that collective existence and representative role, CHAs will always have to serve as liaison to represent all actors and players. So now, a key question. So what happens if someone would wish to form a CHA, or what are the key requirements of a CHA that is supposed to be functional, recognized, corporate, and the rest? Now, there are three key requirements that anyone wishing to set a CHA or already having a CHA will have to really, ensure its compliance. One is that in a desire to establish a CHA, there must be a legal or corporate status. In other words, that CHA must be registered as an entity in a country, in a certain jurisdiction governed by laws and regulations that are there. So recently, ACHAP was very much excited to be notified of the registration of the Christian Health Association of Cameroon, CHAC. And that was very important because you need that key corporate status to be recognized as an actor and a player in the health system of the country. Very important. Then the second requirement is about having a constitution. A CHA must be governed by a constitution, and the constitution will have to define the specific objectives, the membership, the governance structures that are there, and indeed it's a key requirement in that bringing separate denominational groups together requires certain order, certain regulatory role, and the rest. Very important. And if you have the constitution, it must be supported strongly by a charter. The charter is very important. The constitution is just like an act of parliament, and a charter is just like a legislative instrument to provide a guide in the way key stakeholders would interact amongst themselves to avoid conflict. Remember that a CHA is a coming together of diverse denominational groupings, and therefore there should be modalities for interactions, guidance, and the way we have to act. The charter will also guide, amongst others, the principles driving operational, financial, administrative, legal, and ethical conduct, very necessary. To avoid conflict of interest roles, finance, accountability issues will have to be there, very important. Amongst others, the charter will also ensure that all parties understand roles, liabilities, and limitations of each stakeholder. Very important. In coming together, diversity in unity, definitely, we must demonstrate this. And so, what are the key competencies one will require in managing a CHA? this is a very, very important area that we have to amend ourselves to. Remember, on all the roles that I identified earlier, I mentioned that CHAs are involved in negotiations, in channeling and raising resources to ensure that members receive benefits in terms of resources to ensure the growth and sustainability of their constituent members. And therefore, these two key competencies I'm about to mention are very relevant. One, in managing a CHA, one should have the skills and competencies in the art and science of negotiations and partnership development. A CHA is always involved in managing a complex array of internal and external relationships and initiatives. And therefore, the need to scan and sense the needs, the concerns of partners is very important. And then the actual interaction with partners in such a way that we maintain and retain partnerships are very important. And of course, in getting resources, in building connections and relationships, business development as a skill is very important. A CHA must always scan and scope for opportunities, for growth, for development and sustainability of its constituent members. And these are very key functions every CHA is supposed to, imbibe, supposed to learn, supposed to acquire. Very important. Friends, I'm happy to end here and to welcome questions from all angles. It's a pleasure being with you, and thank you very much. Over.
Thank you so much, Peter, for that presentation. It was very informative. Like I said, I was very excited as I got to read through your presentation ahead of time and learn everything that I realized I didn't know. I encourage everyone on the call, please, if you have any questions, type them in on the Q&A section, and we'll get to those in a few minutes. I know I have a couple of questions prepared that I wanted to ask, and first, I want to direct this first question. I guess I want to bring Lebo into the conversation because I know she has a lot of good things to add as well. And Peter did a wonderful job of explaining all the benefits of the CHA organization. And one thing I was wondering to myself, and because we work in a lot of different countries, what is the extent and scope of the CHA organizations? Meaning, how many are there in Africa, roughly? How many around the world? And then the third part of this question is, are there any areas of the world that you think are really lacking in this Christian Health Association representation? Lebo, would you want to take the first stab at answering that? Just remind you to unmute yourself. Lebo, you're muted.
I'll only concentrate on the African continent. And hello, everybody. Since you are representing the Africa Christian Health Associations platform, there are about 40 members from different countries who are members of ACHAP, and all of whom are the national networks in the form of a CHA. So all of them are representing, like Peter has already indicated in his presentation, all of them are representing different denominations who make up the membership of a CHA. Yes, I believe there is a need in other parts of the world to have a national network which can speak in one voice for the faith communities, or at least for the Christian health facilities, and speak in one voice to improve health and healing in their countries.
Thank you. Peter, would you have anything to add to that about the scope of the CHAs? And remind you to unmute yourself.
Yes, so definitely, yeah, thank you very much, Barbara. Just as Lebo has said, that on the continental stage, the CHAs are growing. In countries, you are having both composite and split type. Just as I mentioned, Uganda, you're also seeing Nigeria is also coming up, in Liberia, in Sierra Leone. So precisely the case what Lebo has said, that CHAs are now assuming and asserting their relevance, their role, and their identity in the health space, country health system space. And that is very much encouraging. And what is probably left is to see how, their scope in terms of, value add could be really enhanced. Probably I'll stop there and then answer more questions from your end. Just as Lebo said, it is a growing phenomenon that out there.
Thank you so much, both of you, for your answer. I had a question about outside organizations becoming involved in CHAs, and what is so obviously for organizations in country on the ground, the benefits explained for being involved are immense. I can highly encourage everyone to be involved. How would an organization like a funding organization or an organization that might be involved in resource mobilization or to help support a joint procurement effort of equipment or training or medications, how would they best engage with the CHA organizations? Lebo, you want to answer that first for us?
Yes, Baba. CHAs in their own rights are health service providers in their respective countries, providing a comprehensive care. And they constitute about 30 to 70% of healthcare in different countries. It becomes even huge when you go to the rural areas, whereby you'll find that most of the services that are provided there are mainly by the CHAs. Therefore, for an organization to join a CHA, I would rather say to join the work of the CHA and collaborate at the service delivery level. Because, for example, membership into CHAL is only for the member churches or the churches who have health facilities in the country. However, collaboration is open for all the people or organizations who are willing to support health and healing. Therefore, in order to do that, we can look into the websites of different CHAs. We also have the Secretariat of ACHAP, which has all the contacts, which has a database for all the members from different countries, whereby any organization that would want to partner would find some contacts or linkages to different country CHAs. It is important that these organizations do join and collaborate with us, because one of the good things is that the CHAs have community links. They are already embedded within different communities of different denominations. So their work is within and amongst and for the communities. So collaborating with a CHA already gives you a leverage, because it's a system that already exists. It's a system that can link you to the communities. In order for the health services or healthcare in general to be improved, there is need for all the hands to be on the deck so that we give that value to the communities that we serve. Thank you.
That was very helpful. I can see that as you engage and get to working in a new country, I know that's a position we find ourselves in. It's very wise to work at the top from an organization like a CHA, as opposed to trying to come in from the bottom up. I think you would waste a lot more time and be much less impactful than if you come in and work with the existing structure like the CHA. So thank you very much for that answer. I'm going to go now. We have quite a few questions coming in, so thank you. And I encourage you all to keep typing in some more. We had one question come in from Ted Lancaster, and that was taught that, and I'm just going to read this question to you, both Lebo and Peter, and then either one of y'all can answer it. The question is, how can Christian organizations working collaboratively amongst clusters of community groups best link in with and mutually benefit from the CHA in their country? And he's referencing the work of the Aruka Health Network as an example.
Okay, thank you very much for the question. Very important. In many ways, this question emphasizes one of the key advantages CHAs have, which are access to three key safe public spaces, including, when you speak of the community, we have the community of churches. CHAs have access to churches. CHAs also have access to hospitals. CHAs also have access to schools. You remember that early missionaries established schools, hospitals, and also, and then churches. So these are communities. So CHAs are usually involved in community-based initiatives of high national impact. And therefore, for an organization wishing to partner a CHA at the community level, I would say probably the best ally or the best, champion of community-based initiatives are CHAs. However, CHAs are always exploring relationships that are ethical. So when you have a CHA or a partner whose mission or whose probably objectives are aligned with our collective goals, then naturally CHAs explore such partnerships at all levels. Remember, one key role or function of a CHA is partnership development at national, regional, local, or community level. Very important. So CHAs are always interested in collaboration, not competition. Very important. We always explore that collaborative relationship, not competition. We always avoid duplication, and we always seeking to harness and optimize partnership to ensure that our clients benefit the most. So they are most welcome, and countries all over have CHAs that are very active in the community level and all the social spaces that I've already identified. Over.
Yeah, thank you for that. I love the way you talked about the cooperation versus competition. I know a word that we frequently use around here at our organization is cooperation, where we kind of have our own interests, and they can sometimes be a little different, but we come together to cooperate in areas so that we can maximize impact. And another saying we always have is, how do we work together to make 1 + 1 = more than 2? And I can see that the work that Lebo and Peter that you're doing with the CHAs is exactly what you guys try to do each and every day, is to create that community, to create that connection. We have a couple questions coming up that I want to turn to that kind of, I guess, piggyback off my first question about where the CHAs are located. So I'm going to maybe link these together a little bit. There's a question from Uisa Yaha. I apologize for butchering your names. I really am sorry. The question, is a CHAs, are they in French-speaking countries in Africa yet or not? And then another question that came along the same area from Ronald Poost is, are CHAs flourishing in Francophone and Lusophone Africa? And again, I apologize for my brutal reading and pronunciation, but maybe Lebo or Peter, you could answer those questions regarding the CHAs in Africa. Peter, you're muted. I just want to remind you.
Yes. Am I on board now, please?
Yes, you're good.
Thank you very much. So to the question of whether Francophone countries are part of ACHAP CHAs, the answer is very yes. ACHAP is a coming together of CHAs in sub-Saharan Africa. So it's a continental body, and language is definitely not a barrier. And let me cite some Francophone countries that are part of ACHAP. Chad is part of, one of our members is Chad, and now Cameroon, well, Cameroon is bilingual, and they are also part of ACHAP. Now we are also trying to establish a CHA in DRC, very well. But let me concede though that one of the key active members, I will say, in ACHAP, most are Anglophones. And one of the targets for ACHAP in the years ahead is to ensure that we ensure the active inclusion of our Francophone compatriots over the inner environment. And one of the ways that we are contemplating or doing is to remove that language barrier. Very important. We have a shared mission, we have a shared objective of promoting Jesus Christ Healing Ministry, and I will say that Rwanda, we have Rwanda being a member of ACHAP fraternity. In the years ahead, as I've said, we would expand our reach, our scope amongst our Lusophone and Francophone brothers, and we are trying to expand. ACHAP is barely 10 years old, and these are some of the questions that inspire us to be all embracing or encompassing. It's a journey we are very happy to embrace. Over.
Great answer. Lebo, do you have anything to add to that regarding the additional countries?
Just to share the excitement of welcoming the Christian Health Association of Cameroon, which has just been established. There were a number of faith-based organizations there, and they have now come together under one umbrella, and congratulations to them.
Yeah, that's wonderful. That's wonderful news. I do have a great appreciation for how difficult it can be, the job that y'all do of collaborating so many different people with so many different little interests and uniting them in one. It's a much needed and valuable service, but it can be difficult. So it's great to see Cameroon come together for that. Lebo, I'm going to address this question to you. I think this is a good one that's been asked, and it's, what are the requirements of being a member of a CHA organization?
Thank you, Baba. And one of the requirements of being a member of a CHA is to be a Christian organization. I will just take an example of CHAL, and CHAL is Lesotho. You have to be a Christian church and also have a health facility. And to be a member, you also need to be registered in your own right and have the approval or permission to work within the health sector by the Ministry of Health in the government, in the country. So I believe this in general is a general condition for all the CHAs, with the exception that there are some of those churches health associations which welcome membership from Christians and other faiths, such as Muslims. But you have to be involved in health and healing.
Great, thank you for sharing those requirements for membership. I think I actually had a few questions on that, so great. That was a great question. Thank you for asking that. Thank you all for sending in your questions. I encourage you to keep doing that. We're going to get to as many as we can. One question that has come up, maybe Peter, I'll address this one to you first, is do CHAs organize international congresses? I guess bringing in lots of other organizations. So can you address that one, Peter?
Yes, thank you very much. So if we take ACHAP, ACHAP organizes a biannual conference every year, meaning that every 2 years, the ACHAP members will come together to deliberate on certain themes, current issues in the health space, and come out with resolutions and strategic directions to guide our operations for the next 2 years. So yes, we have this continental, meetings once in every 2 years. And the recent one we had was in Cameroon. Cameroon, we had it in February. And one of the key outcomes of our conference, biannual conference in Cameroon, was the birth of the Christian Health Association of Cameroon. So it has been strategic, it's been exciting, and it's been an environment where we fraternize, we strategize, and we incentivize the membership very well to have that sense of belonging as Christian health, associations devoted to promoting a common mission of, of Christ in ministry all over. So the answer is yes. And then beyond that, we also encourage in between our members to have sessions, retreat sessions, in between the 2 years, where there's an opportunity for us to come together on skills building, meetings. We just do so. And we are waiting for more of such opportunities to fraternize and meet and bond and build skills to promote our common mission. Thanks.
Thank you. Thank you for that answer. Lebo, do you have anything to add to that? Otherwise, I'll go into another question for you.
Just to add that not only those that we organize, we only participate in different international organizations where member chairs present their work, share knowledge with all the other counterparts within the sector, and share the innovations in different countries. We use platforms like the CCIH conference to meet up there between these 2 years where we don't meet as ACHAP. We use those platforms, and that's where a lot of networking, a lot of partnerships are fostered, and a lot of advocacy is done collectively as chairs. Thanks.
That's wonderful. Yeah, that's great. That's definitely that collaboration community is so important, I think, in getting things done. Along that line, we had a question come in from Joseph Kaiwood that is a really good one, and I think if I'm reading this correct, it addresses the relationship with ACHAP and the CHAs and how you, as both you being really both, you're a part of ACHAP, but then you also represent your individual CHA organization. How does the lead organization collaborate with the CHA organizations in each individual country, and specifically some of the more smaller communities and countries? How do you at ACHAP work to strengthen and support those programs? Peter, can you unmute?
Well, very well. Yeah. Okay. Thank you very much, Barbara. Yes. How do we collaborate with our constituent members at country level and also at the community level? Yes. ACHAP. One of the key functions of ACHAP is to ensure, skills building, capacity building, and one pathway is mentorship. Amongst us, we have our distinctive competencies, our individual strengths. And recently, when you had Liberia, Christian Health Association of Liberia coming to Ghana for some mentorship, you have Christian Health Association of Nigeria going to Kenya, some mentorship. And then you have also other countries going to Uganda to build that thing. We believe strongly that if we build these capacities at the national level, it will trickle down to the community level within country settings. And ACHAP is always trying to explore opportunities for its constituent members, CHAs, so that they have the requisite capacity to really enhance their constituent members at community level. And where we also have programs and projects that will inure to the benefits of individual hospitals and membership over there, definitely, I mean, we promote that particular agenda. So ACHAP continues to explore opportunities. We continue to connect our members to see what can we learn, the spirit of South-South collaboration, North-South, and ACHAP is regionalized. We are regionalized into Southern Africa, Western Africa, Eastern Africa, and all the regions of Africa, except North Africa probably. So this is how we really, bond and build our intra-partnerships, so to speak. Over.
Great, thank you. Lebo, anything to add to that as a leader at ACHAP as well? Oh, I remind you to hit your mute button.
Sorry, one of the competences and strengths of ACHAP is to mobilize resources for the different chairs. We have recently been implementing various projects. One could just name, for an example, a WASH project that was supported through ACHAP by Global Water 2020. That was in 5 countries. So a number of those benefits are distributed evenly for benefit of different members of ACHAP. So that keeps us to interact close enough to share and implement and learn in terms of programming and project management. But also one thing that I wanted to add is that because of now ACHAP has become a family where different members know which one is stronger in which areas. So it is always able and easy to tap from all of those different strengths whenever an HR requires assistance or support. As it is now, we are in a very interesting phase where the faith communities are recognized for their response to HIV. And what is happening around is learning from each other in terms of how do we program, what do we program, what do we put into a program as a response, and what has been the best practice in different countries, and what is it that we can use as we are competing for those grants. And it has proven to be a very good platform for that.
Great answers, both of you. Thank you for those really great practical examples of how how ACHAP is supporting the work of the different CHAs. It's a lot of amazing work happening with the collaboration and the structure. I know I'm personally just impressed with the structure of ACHAP and all the CHAs and the effectiveness that you can have now that that structure is in place. Our next question comes from your presentation, Peter. And it's regarding the joint procurement. Just asking for a little bit more elaboration or maybe a specific example of how the CHA members can benefit from joint procurement. Maybe you have a specific example of that you could share?
Yes, thank you very much for this question. We have specific examples in Kenya. You have MED, you have DMS in Uganda, very important. Now, Ghana is also coming on board. We are trying to establish what we call digital supply chain systems, because we are aware of the power of many. Now, we are aware that when we procure medicines from by different hospitals without one coordinating unit, prices of medicines cannot be controlled, and even quality of medicines cannot be controlled. So Ghana is now CHAG is now established what we call digital supply chain system, where as joint procurement, where we are able to negotiate with our suppliers about prices, and then we are also able to ensure a supply chain system that ensure the quality of medicines and equipment supplied to our institutions. It's about ensuring, access to quality, affordable, and acceptable medicines, ensure that our last mile distribution goes to the patient and the prime. So in Kenya, MED has been one of the celebrated, church-based joint procurement, organization. And then you also have, Uganda, JMS is there. And most of our countries are also exploring the possibility of having this joint procurement, because we believe strongly that if we can harness the power of our association to have national level negotiations, we will always have, we always optimize our strength far better. So joint procurement exists in countries. Equipment are procured at a national level, in other places medicines. And I believe that Lesotho also have a similar experience as Kenya, Uganda, and Ghana too. And it's been proving that if you are able to come together to ensure national negotiations, you're able to reduce medicines by as much as 30%. That is the experience we've gotten in Ghana, different from the general public pool. So there are merits in that, yes.
Yeah, that's a great benefit of reducing costs. That's wonderful. Lebo, would you like to add anything to that about your experience in Lesotho and how the joint procurement has been a benefit?
Well, we're not doing that yet. That's one of the areas that we are now exploring to see how best we can do that. Okay,
great. It sounds like there's some neighbors that have some good examples you might be able to piggyback off of, which is another wonderful advantage of the ACHAP network and the way the CHA organizations can communicate. Our next question comes from our very own CCIH Executive Director, Doug Fountain, regarding population movements. So I'll give this one to you first, Lebo, and then Peter, if you want to add on at the end. But ACHAP's 5,000 facilities and related community programs reach far into the villages, estimated that 70% are rural, which meaning approximately 30% are urban. As populations move to the urban areas, what unique value do CHA network facilities offer in urban areas, and are urban Christian programs growing in line with the population? So Lebo, I'll ask you what you're seeing in that area.
Though most of the health facilities are in the rural areas, there still are quite a significant number of those within the urban areas, and they are still providing a comprehensive care. You know, what is happening is that we're complementing healthcare in the country. So in all the areas where a health facility from HR is available, those benefits are for all the members of the community. Our programs are in such a way that it doesn't exclude anybody of any status in the provision of services. But again, in addition to the different services that are provided by health facilities, there are projects and programs that are implemented, which most of the time would be implemented from if for lack of a better word, from the headquarters level. For example, we will be implementing now different projects in response to HIV. For example, the provision of MMC services, it will be done in the urban areas, in the urban districts. So it says already there are programs and projects that are, though they are comprehensive, and everybody is eligible respective of the location, but there are those that are targeted to the urban areas based on the needs on the ground.
Great,
We are also a member in Lesotho. We are also a member of a faith sector core group, whereby CHAL normally participates in different activities of different faith communities, especially for service provision, to try and support those faith communities which do not have facilities, whether they are in the urban areas or in the rural areas. So that's part of our programming, to collaborate with the entire faith sector in the provision of health services. And most of the activities are done in the lowlands, and that's the urban areas.
Great, thank you. Peter, would you like to add to that about what you're seeing?
Certainly. Yes, certainly. Remember, all the CHAs are pro-poor organizations. We are always interested in equitable inclusion in the health space. And one of the key phenomena that we are observing, that the socioeconomic development of countries and urbanization are rather leading to, urban poverty, migration to the cities. You find that even it is becoming difficult to access quality health services in urban centers. So what faith-based institutions are doing is to identify these poor, neglected people within the urban settings. There is this mistaken belief that everybody in the urban area is probably richer. That is, we are finding that not to be true. So now some faith-based providers are targeting the slums, the ghettos in urban areas, and to provide services that are there. And you find a lot of migrants in urban settings that require services that are there. So you find more health inequalities in urban areas other than other than the rural areas sometimes. So it's about balance. And in Ghana, we are realizing that access to healthcare, paradoxically, in the cities is becoming more difficult than in the rural areas where where faith-based facilities are located. And even we are also seeing that most areas where faith-based facilities were originally located are now becoming urbanized. And the value add that we are giving them is the quality specialist services that we are providing to other people who otherwise have to travel all the way 200 kilometers to the cities. So regardless of the changes in social demographics, faith-based providers are more relevant than ever in addressing health inequalities and inequities in all areas, including cities, the villages, and the rural areas that are there. Over.
Great question and great answers, guys. Thank you for that. I was really not aware of the more difficulties accessing services in urban areas. So thank you for the question and the great answer. So everyone, we have 3 minutes left, and I am going to apologize because we're not going to get to all the questions, but I do want to make sure that we will get those answered via typing to the answers to those that have asked. I want to ask one last quick question before we close. And this is a question that came in from Mr. Shop, and it's one near and dear to my heart too. I guess it's regarding kind of mapping services. And the question is this: are there any assessments or descriptions of ACHAP individual member capacity or needs by country and or network wide, which can be shared with interested partners? So does ACHAP gather that data, and can it be displayed and shared with others so we can see the scope of the work that y'all are doing?
Yes, very well. It is an important strategic priority that ACHAP, ACHAP has been really exploring. And we believe that it's probably far more relevant in an era of universal health coverage and SDG, where we're exploring ways and means of improving access to quality, affordable healthcare. Very well. So I think we have a sense, we have anecdotal evidence, facts of the needs of our member institutions, individual we have, but when it comes to probably a composite, well-mapped thing, I think it is one of the areas ACHAP is continuing to knock on the doors of partners so that we would probably have a sense of, robust priorities, response priorities for our members. I think for now, ACHAP has its strategic priorities. We have strategic documents that are there. We have a sense of the need. And I think that we have much more to do in the area of mapping our strategic needs and priorities as pathway to achieving universal health coverage. Lebo may add.
Any quick comments from you, Lebo, regarding that topic?
It's just that we would be happy to share that with CCIH so that there could be information that is shared with the participants regarding the database of ACHAP.
Wonderful, thank you. I think that they're probably definitely going to be interested in that. So our time is up. That went by really fast. I thank you both so much for sharing your time and sharing your expertise and sharing your experience with us, with all the work that you're doing both at the continent level and then at the country level as well. It's just remarkable work. I'd like to remind everybody, thank you all for participating and joining us and asking the wonderful questions. You will get a link tomorrow or in the near future to get the copy of the webinar. You'll also be getting a quick survey to get feedback on this webinar and ask for some interest in future topics, because I know it's definitely CCH's heart to make this really relevant and practical for all of its members. If it's okay with everyone, I know it's 10 o'clock, I just want to offer a quick prayer, really a quick blessing that was laid on my heart for both Peter and Lebo and all of the CHAs working around the world. It just really hit me, like the effect of the work you have. You touch so many, you probably are just in it every day dealing with problems and you don't think of it, but the work you have due to the amount and extent of organization and collaboration you have is really, really remarkable. So just like to make a quick prayer. Dear Lord, we just thank you for this time. I thank you for both Peter and Lebo and their commitment to you, their commitment to give their lives to serving you and the Christian healthcare community, their commitment to collaboration and connectivity, to cooperation and support. We know, Jesus, this is your way, and I just ask that you give them strength and wisdom. I lift up all the other leaders of these CHA organizations as well, Lord. May you give them the vision, the strategy that really, really directly impacts the patient care and allows many more to be served and dramatically improves the quality of care. We thank you for this time, Jesus, and we love you. Amen.
Amen.
Thank you all again. Really appreciate you taking the time to join us. And good night for those of you in Africa, and for the rest of you, have a great rest of your day.
Thank you so
Thanks,
much.
Barbara.
And
Good night.
wonderful facilitation, moderation. Congratulations, Barbara.
Great job, guys. You did great. Appreciate it.
Thank you.
Bye.